More, I want to bring in two experts that we certainly depend on here. Dr. Kavita Patel, clinical physician and former senior policy director during the Obama administration, and Dr. Vin Gupta, a global health policy expert, pulmonologist, and an MSNBC medical contributor. Dr. Patel, have you ever seen anything like this before?
I haven't. And Stephanie, I've been in D.C. for a long time, actually worked on a lot of this legislation to support the CDC across the aisle, Republicans and Democrats. And this is a first. And quite honestly, it's evident in how everything has been botched, and not just with Dr. Monarez, but also with so many other appointments that's gone through. And remember, she's not the first. Remember, they had a candidate, a House of Congress member, Dave Weldon, that they pulled also kind of at the last minute. So it's clear there's an agenda here, and it extends way beyond the CDC.
Vin, what do you think?
Well, I'm grateful to be with two real experts here. Stephanie, you and Dr. Patel, great friend. Just to echo what Kavita said, I'm worried as we approach respiratory viral season, Stephanie, and especially with all this churn on the COVID vaccine, the fact that there is a discrepancy between what Kennedy's HHS is putting out there and what you're seeing leading entities like the American Academy of Pediatrics and Dr. Susan Presley, who I had a chance to speak to yesterday, the president of that academy, fiercely disagreeing with what they're putting out there in terms of narrowing the scope and who can actually get access to this booster shot. A lot of people want access to it. A lot of people living in multi-generational households, a lot of other indications. Thousands of people get hospitalized still every single year, Stephanie, not much better than it used to be, but there's significant disagreements, and now we're leaderless at the very top.
Kavita, what do you think about that point? This is coming on the very same day we're watching the FDA restrict COVID vaccine approvals for Americans that they say are higher risk. Given that that is happening, what are your concerns about how public health is being handled?
Yeah, first of all, it's a state of confusion, not just amongst the American public, but amongst American health professionals. We've got pharmacists. Literally, I've recommended patients getting vaccines, not just COVID, but other vaccines, to kind of talk with their pharmacists, because that's where so many people are getting shots. And pharmacists are saying, we don't exactly know what's happening. That's not a good answer in 2025 when we have learned so much from not just COVID, but as Vin pointed out, respiratory virus season. By the way, we're in the thick of it. We're seeing cases going up. We're seeing these visits in urgent care. So to have that in the light of not understanding what public health is doing, and Stephanie, I worry, we're talking a lot about COVID for a very good reason right now, and what the FDA did. But this is not going to end with the COVID vaccine. It's just beginning, and it's going to extend to anybody who brings forward any vaccines, even the existing ones. We've already seen that from the advisory committee that basically RFK completely replaced with people who, quite candidly, Stephanie, you can't help but think, replaced it with people who are now just stoking fear and creating basically their plaintiff lawsuits against every vaccine manufacturer, whether or not there's a base for that claim, and putting that in, unfortunately, on taxpayer dollars, putting that into black and white.
Then, Vin, what do you think our government scientists are facing on the job dealing with this administration? I mean, in her statement through her lawyers, Monarez warns that she said, our evidence-based systems are being undermined from within.
Stephanie, I mean, innovation at the NIH, as supported by the CDC and health systems across the country, takes time. And it requires not only resources from the NIH and from the federal government more broadly, it requires people likely to take a pay cut and to be in that position to know they have job security for the better part of decades. And what's going to happen here is people are going to see the writing on the wall and want to leave. It's already happening. We're seeing there's surveys saying, Stephanie, 80% of scientists surveyed by the medical journal Nature said that they are considering leaving. About 1,600 scientists were surveyed back earlier this spring. 80% of them said that they were considering their options. So that is going to have an impact on innovation. It's going to have an impact on the treatments and vaccines Dr. Patel and I will be able to give our patients down the road. So this is going to be generational.
Kavita, then given all of this, how are Americans supposed to trust that we are getting accurate health information from our government?
Well, candidly, they're not. But here's some good news. I just want to put a little bit of a silver lining. Americans have stated and said it day in and day out that they trust their health professionals. They trust people like Vin and myself. So in that one-on-one relationship, Stephanie, we still have the ability to educate. And education goes both ways. This isn't just like, a hierarchical education. I need to hear, what are you worried about? And I think those honest conversations are coming forward. But the truth is we're not going to be able to do that at a mass scale. That's why the CDC was stood up decades ago in order to be able to offer not just American population public health stance, global population. Started then with malaria. It has continued on. So Stephanie, this is a turning off of a bright light across the world for what we have to do. And now we're going to have to rebuild it literally one brick at a time. That's what we're going to have to do. But people will unfortunately die in the process, be hospitalized unnecessarily in the process, not to mention cost of healthcare will rise. This is one of the areas that brings healthcare costs down, prevention. It will rise in light of this, and it's going to happen in a much shorter time frame than I had ever expected.
I mean, it's stunning. Operation Warp Speed, the development of the COVID vaccine was the shining, crowning achievement of the Trump administration, one of the best developments in modern history. And now here we have Trump's second term, his administration seemingly looking to kind of erase it, wipe it out. What are your biggest concerns going forward, Vin?
Kavita touched on this, Stephanie. I thought, just to make it clear for all your viewers and just for the public more broadly, when the FDA narrows an indication, say for the COVID vaccine, who knows what they do down the road under this regime, that directly impacts what your retail pharmacist and this pharmacy down the street from you can and cannot do. We got used to getting our vaccines from our pharmacists, right down the street. They cannot do it now. They cannot, for example, if you're 50, otherwise healthy, you can't get the COVID booster if you wanted it at your retail pharmacy because they have to follow guidelines by the FDA. Now, take it from the provider standpoint, Stephanie. Kavita and I, as providers, we can say, you know what, we're still going to prescribe it and we'll immunize you for it off label. But what did Kennedy actually signal? He signaled that providers, and he was saying this in reference to the AAP's guidance in contradiction to what they put out, that providers should be wary of prescribing vaccines off label because they could open themselves up to litigation. And so this is a chilling threat. And we're just in this new normal here. But I want to make sure people understand the broad impacts that this is having on your day-to-day healthcare right down the street and what providers now are potentially vulnerable to from a litigation standpoint.
Vin, Kavita, thank you so much for joining us tonight. Really important stuff.